Hi, good morning. My name is Mark Jacoby. I want to talk a little bit about the structures of the eye. I'm going to pick three structures. I'm going to go over the main functions of those structures, um, common diseases that affect those structures, and then also the nursing, management, health promotion, and teaching for those diseases. So the structures I'd like to talk about related to the eye are the sclera and the cornea. The function of the sclera is to protect the eye. It's made up of a clear or opaque fibrous tough outer layer known as the white of the eye. The sclera protects the cornea and optic nerve and provides protection against infection and helps to lubricate the eye. The cornea is the outermost lens of the eye. The cornea is the window that refracts and bends the light, which then sends the signals to the optic nerve. The cornea also acts as a barrier and protects the eye against infection. The next structure I'd like to talk a little bit about are the tear ducts. The tear ducts are the small openings in the intermedial part of the eye. They're known as the punctum. There is an upper and a lower punctum in each eye. They act as little valves that allow the tears to drain from the eye. So when we blink, the tears help to clean and lubricate the eye. Then the tears drain into the puncta, the tear ducts, and into the nasolacrimal duct, which is like a thin canal that empties into the nasal cavity. And then the third structure I'd like to talk about are the eyelids. They're a thin layer of skin that covers and protects the eye. There's an upper and lower eyelid for each eye. The muscles in the eye allow the eyelids to open and close. There are eyelashes at the edge of the eyelids to help protect the eye from small particles such as dust and debris. And they also protect the eye against sweat and perspiration and foreign bodies. So now I'd like to talk a little bit about some common eye diseases. So, as related to the sclera and cornea, one common eye disease I picked is pink eye, also called conjunctivitis, which is inflammation, discharge, and redness of the eye. It's a bacterial infection that is contagious and can spread to others when symptoms are present. Although pink eye will go away on its own, we can treat pink eye, and the clinical manifestations would be swelling, redness, a thick yellow discharge, itchy eyes, blurred vision, and a burning sensation. The testing for pink eye can be done by a doctor by asking questions about the symptoms. An office visit is not required for them to diagnose pink eye. In some cases, the doctor will perform a culture or swab test analysis. Antibiotic eye drops or topical ointment may be given, and common drops or ointment for medication would be tobramycin. The next disease or condition I'd like to talk about is related to the tear ducts, so the puncta, and it's blocked tear ducts, which is also called dacryostenosis. And the causes of the condition include inflammation, infection, trauma, scarring, or even a tumor or mass or some kind of lesion. Neoplasm could be benign or cancerous. The lacrimal duct becomes blocked. The tears will sometimes run down the face or the cheek. Discharge that is yellowish or greenish in color, excessive tearing, watery eyes because they're not draining into the lacrimal ducts, and they can cause that excessive tearing because the tears have nowhere to go. The doctor is likely to order a CT scan or MRI for the testing. The doctor will also perform a procedure that injects sodium chloride or saline into the puncta or the tear duct to see if they can flush it through. So it's a procedure that they can do in office. They'll use a little numbing drop, and then they will try to clear the blockage. Or they also use it as a diagnostic measurement to get a feel for how much it is blocked. So whether it warrants any surgery. And the way to fix that, if it cannot be cleared, then surgery would be recommended or maybe advised. The last condition I'd like to talk about is droopy eyelids, also called dermatochalasis or ptosis. The eyelids are a major structure of the eye, and they function to protect the eye and help with lubrication as well. When the eyelid is drooping, it can cause impairment of vision by blocking or limiting the field of vision and light that comes into the eye. There are the two primary types, which are the dermatochalasis, which occurs when there is an excess or loose fold of skin that starts to hang over the eye. And the other type is called ptosis, which occurs when the muscle that controls the upper eyelid becomes weak. The clinical manifestation are impairment of field of vision and reduced light. The affected areas are the muscles of the eye and skin around the upper eyelid. Testing includes CT and MRI. Measurement of the distance between the pupil and the lower eyelid, which is called a MDR. It's a margin reflex distance. Margin distance reflex. I think it's actually pronounced. Visual field testing that tests for peripheral vision and also the amount of light that the patient is seeing. The general treatment is a surgical procedure for dermatochalasis, which is the removal of that excess skin on the eyelid, and for ptosis, it's a tightening of the upper eyelid muscle. The procedure is performed usually in an outpatient surgery facility under local anesthetic. For the nursing management of pink eye, health promotion and teaching, the nursing management would include an assessment of the eye, definitely asking questions such as duration, pain level, color, discharge, and other signs. The nurse may administer eye drops or topical ointment that are ordered by the doctor. Health promotion includes encouraging the client not to touch or rub the infected eye. Make sure to take any prescriptions as directed by the doctor. Patient education includes washing your hands frequently. Avoid sharing cosmetic eye makeups with other people. Also, if you wear contacts, you want to make sure that you're cleaning those properly and not leaving them in longer than as instructed. The nursing management for the blocked tear duct, health promotion and teaching. So nursing management with the blocked tear duct would also involve the assessment of the eyelid, making sure to focus in on the tear duct and eyelid area. The nurse must assess for proper tear drainage, redness and swelling, pain and discharge. Health promotion includes making a Appointment with a specialist, such as an ophthalmologist. Avoid rubbing the eyelids because it can irritate the eyes and lead to excessive tearing. Teaching includes applying medications as instructed, gently massaging under the eye to stimulate the glands to help stimulate that drainage or that flow. Also, applying cold compress can reduce inflammation and swelling. And then the nursing management for droopy eyelids, again, would be assessment of the eyelid structure. Visual acuity tests can be given. The nurse would also want to definitely refer to an eye specialist, such as an ophthalmologist or a plastic eye surgeon. Health promotion that would be helpful for clients who have undergone a surgical procedure would include teaching how to apply the topical medication and the eye drops, applying cold compress, avoid rubbing and touching the eyelids during the recovery, avoid bathing or getting them wet for up to a few days as instructed by the physician. Teaching the client would include informing the client of the progression of the condition, so what treatments involve generally would be a surgical procedure, and taking the mild to moderate pain relieving medications as needed after the procedure. And that pretty much concludes my video here on the structures of the eye with function, common disease, and nursing management. Thank you.